And now we will proceed nasogastric feeding. So, purpose is to provide feeding, to aspirate gastric contents, to administer medication, to administer supplement. Then assessment is check the physician's order. Rationale is to know the specific formula at the time we have to give the feeding. Then next is assess bowel sounds. Absence of bowel sounds may indicate decreased ability of gastrointestinal. Then assess clients regarding discomfort from the tube and observe insertion site irritation for clients' discomfort. Then prepare the tube feeding at room temperature and obtain articles equipment needed to save time and effort. Then, identify client and explain the procedure. So, hello ma'am. So, ang gagawin po natin ngayon is magbibigay po ako ng food and medication. Then, place the client to high Fowler position. Then, check for the tube placement and patency. Presence of gargling sounds may indicate tube in place. Then, if you infuse feeding, please pinch proximal end of the feeding tube. Then attach syringe to NGT and aspirate. Then aspirate small amount of content to fill tube. Then fill syringe with measure amount of formula. Release the tube and hold syringe at 12 inches above the tube point. Repeat until the prescribed amount has been delivered to the client. Then instill 30 ml of water into the NCT tube. Then clamp the nasogastric tube before all the water is instilled. Ask the client to remain Fowler position for at least 30 minutes. Then ask the clients remain in Fowler position for at least 30 minutes after feeding. Then do aftercare of equipment. Then wash hand. Evaluate client's tolerance to feeding and response of tube feeding. Then observe clients for compliance of nausea and vomiting. Record time of feeding. Then document and lastly document the procedure. Then Next is removal of nasogastric tube. Then first is verify the physician's order. Then gather all equipment needed. Then evaluate and assess client. Explain the procedure to the clients. So, hello ma'am. So, iaalis na po natin ang nasogastric tube po natin. So, then, elevate and assess client on high or semi-follow position. Then, wash hand and don disposable gloves. Place disposable pads over the client chest. Then give emesis basin and disposable tissue to the client. Then attach syringe and flush tube with 10 ml of water. Then carefully remove adhesive tape from client's nose. Then instruct client to take a deep breath and hold it. Then clamp the tube with finger by doubling top on itself. Then quickly and carefully remove tube which clients hold breath. Then clean and dry face and nose of the client. Perform oral hygiene. Then dispose tube and other equipment properly according to hospital policy. Removes gloves and wash hands. And document the procedures. Thank you.